Hello, good morning. Happy Tuesday. We are going to go ahead and get started here. My name is Jordan Anderson, and I'm a community health nurse with Two Rivers Public Health Department, and this is our monthly surveillance call. So where we are, Two Rivers, we cover 7 counties, 4,624 square miles, with a total population of 97,040. We serve almost 100,000 individuals. These counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. And there's the populations of each county there. This is what we do: disease surveillance, chronic disease prevention, Tri-Cities medical response system, emergency response, Lifestyles dental program, collaboratives, and lead exposure. So our mission, Two Rivers Public Health Department, engages collaborative partners, community leaders, and the public to promote healthy lifestyles, provide preventative education, assure environmental quality, and create more healthy and safe communities for all who live within the district. And our vision right here, in short, healthier communities for all. I'm going to go ahead and put my video off here now. There we go. All right. So this is our Two Rivers Public Health Department nursing team. Over here is Jackie. She's our community health nurse supervisor. Rosa and Marilyn are our program nurses. And then Rita, Liz, and myself are the community health nurses. Our website has changed. So when you search for our website, this is what it's going to be: trphd.ne.gov. And these are the public health regions. Same slide as always. Here is our COVID by the numbers. This was updated August 5th, 2022. So you can see over here, our total US confirmed cases are up to 91,805,380. 7-day average per 100,000 people is 242.1. Total deaths is up to 1,028,062. And then this right here is our region 7 confirmed in deaths. Under here we have Nebraska, Kansas, Missouri, Iowa, so that's our region 7 all split up. You can see here at the top, Nebraska total confirmed is 519,584. And then Nebraska's total deaths are 4,370. We'd like to point out a few things on this dashboard. On the top left, you can see that the 7-day rolling average in cases during 2022, the orange line, is still higher than in 2021, shown by the blue line. Looking at the bottom left, you're able to notice that the number of positive cases reported in red versus total tested. There is a fluctuation week to week in these numbers. So when we look at the bottom right, you notice that the majority of cases are reported in those age 20 to 29 and in people who are over 80. And then on the top right, you can see our current risk dial. All right, and then here's some quick takeaways from the hospital information. So when we look at the percent of beds occupied by COVID-19 patients on the top right, we can see a steady increase during the month of July into August. And the graph of COVID hospitalized, shown in green and yellow on the bottom right, you can see the fluctuations in this graph tend to follow the trends in cases in the district. This graph also shows our recent increase in cases. The graph indicates that cases are rising and we are headed toward another peak. On average, about 15% of the hospital beds that are occupied by COVID-19 patients. So there are 17 total inpatient COVID positive patients as of August 5th.
She promoted Jackie and Katie to panelists, but
Vaughn, your microphone's on. The last notable information on this dashboard shows that ICU availability has fluctuated quite a bit since June, shown up there on the top left. It is important to note that only about 33% of ICU beds were available on the 1st. All right. This is the weekly COVID data tracker weekly review. So many people have been struggling for the past 2 years due to the many stressors that the pandemic has introduced to the world. And unfortunately, children and adolescents are no exception. So pre-pandemic data shows significant increases in mental health symptoms among US high school students during the decade before COVID-19. And an April 22 CDC report found that the crisis has continued into the pandemic. According to the report, more than 1/3 of high school students reported poor mental health during the pandemic, and almost half said they had felt persistently sad or hopeless during the past year. Students who didn't feel close to anyone at school had higher rates of poor mental health, and the same held true for students who hadn't been virtually connected to others during the pandemic. So CDC's How Right Now, this link right here on the bottom, this online guide can help kids identify how they're feeling at any given moment and points them to resources for handling emotions like fear, grief, anger, and sadness. This link, it takes you to advice, hotlines, and support groups. There's also a section with ideas for practicing gratitude, which is a great way to reduce stress and boost your physical and emotional well-being. If you or your teen need immediate mental health support, call 988 for the National Suicide Prevention Lifeline, or use Lifeline Chat to connect with a trained crisis counselor. Two Rivers Public Health Department is tracking the monkeypox outbreak with Nebraska DHHS and the CDC. Two Rivers sends out a weekly monkeypox newsletter. This is reflected on the left here. Numbers continue to rise with 6,617 confirmed cases as of August 4th in the US. 10 of those are in Nebraska, and then that's compared to 26,208 globally. You can see the graphs here in black and the colors right there to show those comparisons. CDC is recommending vaccination against monkeypox using the following strategies: post-exposure prophylaxis. This approach can be considered a standard PEP for monkeypox. People can be vaccinated following exposure to monkeypox to help prevent monkeypox illness. And then PEP++ or expanded PEP. This is for people with certain risk factors who are more likely to have been recently exposed to monkeypox. This approach aims to reach these people for post-exposure prophylaxis, even if they have not had documented exposure to someone with confirmed monkeypox. And then the last is pre-exposure prophylaxis, or PrEP. This approach refers to administering vaccine to someone at high risk for monkeypox. For example, lab workers who perform diagnostic testing to diagnose monkeypox, and providers. Two Rivers Public Health Department does have a limited number of vaccines available. So if you are interested, please follow this link over here or scan that QR code. August is National Immunization Awareness Month. So Two Rivers Public Health Department participates in the Vaccines for Children program. This program helps provide vaccines to children whose parents or guardians may not be able to afford them. This helps ensure that all children have a better chance of getting their recommended vaccinations on schedule. Adult vaccines that are also available include COVID, flu, and shingles with a donation or insurance. The above links here will help you determine which vaccines you or your child are due for. And then this is our back to school immunizations flyer here. So our next clinic is Thursday, August 18th from 9 a.m. to 5 p.m. So here you can see what is required and then what is recommended on top of those requirements. So you can call Two Rivers Public Health Department at 888-669-7154 to schedule back to school vaccine appointments at our office. COVID vaccination for children. So CDC recommends COVID-19 vaccines for everyone 6 months and older, and boosters for everyone 5 years and older if eligible. So this little table here shows the primary vaccine series for children and teens. So you can see Pfizer and Moderna are authorized for everyone 6 months to 17 years, depending on which brand you get, depends on your number in the primary series. And then J&J and Janssen is not authorized in those age groups. Some vaccine side effects we want to touch on real quick. So for children 3 years and younger, common side effects can include pain where the shot was given, swollen lymph nodes, irritability or crying, sleepiness, and loss of appetite. For children 4 years and older, side effects are more common after the second dose and can include pain, swelling, and redness in the arm where the shot was given, fever, tiredness, headache, chills, muscle or joint pain, and swollen lymph nodes. While we're on the subject of back to school, this is back to school safety slide here. So it's important to have your emergency contact information with you in case of an emergency. These cards can be used to keep in your child's backpack and in your wallet in case of an emergency. And they can be found here at this link directly on the CDC. So get those in your kid's backpack here as we get ready to start school. The Life Smiles Dental Program is holding free dental screenings on the following remaining 2022 dates. So beginning in August, the Life Smiles team will also be going to 30 area schools to do dental screenings. To learn more about the Life Smiles program, please contact Two Rivers Public Health Department's Life Smiles team via email at lifesmiles@trphd.org, or you can call our office at 888-669-7154. So COVID testing at our office is Mondays and Wednesdays from 9:30 to 10:30, and all those wanting to be tested must register at trphd.ne.gov. Here is our calendar for the month of August. So you can see we have COVID and VFC clinics coming up there. This can be found on our website. You can bookmark this page and check back often. We update it regularly. Please be aware of the weather. So if a weather warning is issued, the mobile clinic will be canceled. If a watch is issued, please contact us at 308-233-3100 to confirm your appointment. As a reminder, always bring your insurance cards and your COVID vaccine cards to those clinics. And whoa. Whew. All right, that is the end of it. I don't know why my bottom thing got cut off there. Sorry about that. But as we get ready to go back to school, good luck with the coming school year and stay safe and stay healthy. Thank you everyone for joining today.